Good morning, everyone. You're very welcome to today's webinar. For those of you who have just logged on, we have already completed a sound test, and thank you very much to everyone who helped out with that. If you do have any trouble seeing the slides or hearing the speakers, please just type into the questions box and a member of our team will get back to you. So firstly, I just want to introduce ourselves. My name is Jennifer Patton, and I'm the HR consultant for Bright Contracts here at Thesaurus Software. And joining me today is Laura Murphy, who is the Chief Human Resources Officer at Thesaurus and an additional point of contact for Bright Contracts. So this webinar is being recorded, and all attendees today will receive an email later today with a link to the recording as well as the slides. So it's no problem at all if you do need to leave at any stage. If you do have any questions, you can type them into the questions box on your control panel at the side of the screen, and we will try to get through as many questions as possible at the end of today's webinar. And again, as I previously mentioned, there will be a copy of today's presentation slides in the follow-up email also. So to go through our agenda for today, so first up on the agenda for today, we will look at the COVID secure guidelines, the vaccine policy and redundancy. Next, we'll be looking at all things hybrid working and the menopause policy. And then finally, we will look at the national living wage, national minimum wage, and a look at what else is to come for 2022. At the end of the webinar, we will have a questions and answers section where we'll answer any questions that you may have on these topics.
Perfect. Good morning, everybody. Laura here. Thank you for joining us. So we have a busy schedule today, so we'll get straight into it and we'll go right back to February and just look at the COVID secure guidelines briefly. So back in February the 22nd, we had a new roadmap published, the roadmap out of lockdown, and in the roadmap, there were 4 different stages, each triggered depending on the prevailing health data around COVID-19 at the time. But by and large, we got there, and in July, obviously, most of the restrictions were lifted. So with that, we had new COVID secure guidelines. Just moving on there, Jennifer, thank you. So prior to this, we had 14 guides to working safely previously, and that has now been reduced to 6 key points. Just to go through them very, very briefly, we have health and safety risk assessment, we have ventilation, cleaning, hygiene and hand washing, working from home, vulnerable workers, communication and training. So just to look at the health and safety risk assessment and to look at all the points in more detail, but starting with the health and safety risk assessment, I'm sure at this point all employers will have completed their risk assessment in relation to COVID-19, and as part of that you'll be looking at what the risks are. You might also be speaking with any clinically extremely vulnerable workers who are in your workplace, just to ensure that all the safety measures are being taken. Just to note then, if there is a change actually in how work is carried out or where it is carried out, then you may also want to review your health and safety policy. But at this stage, the guidelines haven't changed so much from July, so if you have your risk assessment in place, that's fantastic. But the HSE do have some guidance as well, Jennifer.
Yeah, so the HSE website, it is a hugely valuable resource, and all businesses should really be consulting and availing of it when they're looking at their organization's health and safety. And not only do they have risk assessments available to employers to use, but they also have helpful videos like the health and safety risk assessment and management video. So we just highly advise checking out their resources, as they are really a useful tool.
Yeah, absolutely. So just to move on to ventilation, and I suppose as we've learned more about COVID-19, ventilation is one of those things that has become more and more important. So as an employer, you really must continue to ensure that you have adequate ventilation in your indoor spaces, because that will really reduce how the virus travels in that space. Actually, a new campaign was launched just recently on the 5th of November across digital channels, demonstrating the importance of simple ventilation techniques to reduce COVID-19 again transmission in this winter. And really I'll focus on the word simple techniques there, because it is, and there's actually a little film that's been published And it demonstrates the positive impact of reducing COVID-19 levels indoors by simply opening a window for 10 minutes every hour, and that can really, really help. So just to kind of back up what Jennifer was saying there, have a look at the HSE, and it gives really basic, simple, easy to follow advice on that one. And then just to take the final 4 steps together, starting with cleaning, hygiene and hand washing. This has been important since the start, and it's important that we continue to clean our areas, particularly frequently touch spaces, that we continue to promote that staff continue washing their hands and using sanitizers. So it's important not to become lax, and that can easily happen too, but it's just important to remember to be doing these things. And then moving on, for staff who are working from home, again, just ensuring that they have all their equipment. And we've talked about this a lot in HR circles now, that staff are working from home and we're having that hybrid environment. And how do you manage staff, and touching base with them and catching up with them regularly is really important, as well as just discussing their well-being. You'll also want to consider the risk to workers, again, as we've mentioned, who are particularly vulnerable, and make sure you have the controls in place for them. And lastly, communication and training. Extremely important to communicate any of your revised safety measures, and actually not even revised measures, just remind people of the measures that are in place to prevent that kind of slip as well, but just keep people informed, and communication and training really, really key.
Thanks, Laura. So just off the back of that, I suppose people might be kind of thinking, what should businesses and employers really do next? And really for now, employers really need to focus on these 6 key steps and continue to revise these COVID secure guidelines policies on a regular basis, because as we all know, things do change really quickly and rapidly, and especially as we'll be moving towards the end of the year, naturally there'll be more changes. So this will be updated again, and no doubt probably in the new year as well. So it's just really keeping on top of the COVID secure policy and just making sure that it's updated when the government updates it as well. And this brings us on to the vaccine policy, which is still a hugely topical discussion, and again, one that is changing day by day. So we thought that we'd approach this section as a Q&A to cover all the questions that you may have about the policy. So firstly, we have, can you ask an employee if they've been vaccinated? So it's important to note that employees aren't obliged to provide personal medical information. However, in the case of COVID vaccinations, there is some scope for employers to request this information, but employers do need to be mindful that medical information is considered special category data under GDPR, and they must be cautious when requesting this data. And the ICO has actually issued guidance on this specific topic, so it's well worth taking a look at if you're looking to obtain this information from your employees. Next, then we have, can you insist that an employee be vaccinated? So prior to the 22nd of July of this year, COVID vaccinations weren't compulsory, but recently the Health and Social Care Act 2008 has been amended, which makes it compulsory for a person working or providing professional services in Care Quality Commission registered care homes to be fully COVID-19 vaccinated, unless they have a medical exemption. And for those working outside of this industry, however, there is no basis to require them to be vaccinated. So that's just important to note there. And the purpose of this regulation that came in, which only applies to England, it did come into force on the 11th of November 2021. And there was a 16-week grace period provided, with the 16th September being the last date for care workers to get their first vaccine, so that they'd be fully vaccinated by the time the 11th of November came around there. And very positively, the government has said that they estimate now that by November now, obviously we're coming now to the end of November, that approximately 87% of the care home workforce will have received both doses and be fully vaccinated, which is great news to hear.
So yeah, and I think, Jennifer, you've only scratched the surface in terms of the questions that there are and that exist around the vaccine. So I suppose the best thing for employers really to do is to implement a vaccine policy, and that's what we've been recommending over the last little while. And there's huge benefits of having a vaccine policy, a number of benefits that it can help promote that your employees get vaccinated. So, for example, it can provide your workforce with a list of resources of where they can go to obtain further information about the vaccine. So it will ultimately help them make an informed decision. And even you might want to consider reviewing your vaccine policy now, and even including information if the age groups are changing and it's going into children, that you could update your policy again to just provide more information for staff. And the more information you can provide them, the better, really. It can also help on a real practical level. Having a vaccine policy can help reassure your staff around practicalities of getting the vaccine. Will I be able to take paid time off? And I suppose that's coming up again now as we've got people going to get their boosters. Will they be allowed paid time off, or if they do suffer any side effects, do they have to take unpaid leave, or how will that be dealt with? So that can really kind of fill in some questions for your staff there as well. And it can also as well be a really great place to set the tone for employee discussions around the vaccine, in the canteen over a cup of coffee or whatever. Those can be quite contentious issues if you have somebody who did and somebody who didn't. So you might just want to have that in the policy to, how you want that to be addressed with your staff. So really useful there. But we'll just move on then to redundancy. And obviously with the CJRS scheme closing back in September, since then we have seen, unfortunately, but the rate of redundancies has increased considerably. And according to ACAS, redundancy related calls to their helpline have increased over 160%. So yeah, redundancy is on the agenda, unfortunately. Yeah.
So if redundancies must occur, then we see the following steps should really be adhered to. So just to go through them briefly, and then Laura will give you a more in-depth look. But we have collective consultation, non-collective redundancy, notice of termination, and redundancy payments. And Laura's just going to give you a more in-depth look at these now.
Yeah, just very briefly on collective consultation. I really don't feel that's going to apply to too many of our attendees today. Collective consultation applies where you are planning or proposing to make 20 or more employees redundant in one establishment within a 90-day period. And if this is the situation, then collective consultation is required with either trade union or employee representatives. In the consultation, you must follow the path there. But said it's unlikely to apply to many today, so we'll continue on with the next one.
Yeah, so as Laura said, if collective redundancy doesn't apply and your redundancies are more on an individual level, then this is what is called non-collective redundancy, which is less than 20 individuals. So in this case, you should really aim to avoid compulsory redundancies, either through voluntary redundancies, agreed short-time working, or other flexible staffing arrangements. But you should carry out a consultation with every employee individually. And the consultation, it needs to be meaningful, and your plans mustn't be finalised at this stage, which is really important to remember. And then next is selecting your staff for redundancy. So here employers really need to use fair and objective criteria. Ideally, all employees at risk of redundancy should be put in a selection pool and assessed on the same criteria. So for example, their standard of work, their experience or qualifications, their disciplinary record, etc. And selecting those who may have been on furlough over other employees may not necessarily be fair, and these employees may have been parents with childcare issues or individuals with disabilities, so there could be a risk of direct or indirect discrimination claim there. So it's just really important that when you're looking at your non-collective redundancies, just to ensure that you're following these steps and making it as fair and objective outcome as possible.
Absolutely, yeah. Your selection process is so important, and it's so important that it's transparent, and that you always in the back of your mind you're thinking, if somebody questions me on this, I can explain it fully, and I know exactly why I've picked so and so over so and so, and then that you can justify that. Really important. So I suppose once you've selected your staff for redundancy, the next step is to give them notice of their redundancy. So there is a statutory redundancy notice period. You may or may not be familiar with it, but for those staff with 1 month, between 1 month and 2 years service, it's 1 week's notice. Then between 2 and 12 years, it's 1 week's notice per year, and that's capped at 12 weeks for 12 years service. Excuse me. But contractual notice is always worth checking, because in some situations your contractual notice may be greater than statutory notice. So always, if you're making somebody redundant and you want to give them their notice, the first point to call is check their contract of employment. What notice are they required? And where the contractual notice is greater than statutory notice, then contractual notice will apply. However, in the opposite situation, where if you have your contractual notice being less than statutory, statutory notice will apply. In terms then of what you pay for redundancy, for the notice, sorry, not redundancy pay, statutory notice pay. If the notice in the contract is the same or less than the applicable statutory notice period, 100% of the employee's normal pay should be paid during the notice period. However, things are slightly different where the contractual notice is greater than the statutory notice. So bear with me while I explain this one. So if your contractual notice is greater by at least 1 week, the employee should receive their normal full pay as long as they are working. If they are not working, then they should receive what they would have normally been paid during that absence. So again, just really important to refer back to the contract of employment. How does the notice period shape up in comparison to the statutory? And that will help you decide A, what the length of the notice period is, and B, how you pay and what you pay during that notice period. So from notice period and notice pay, then the next step is the redundancy payment. So an individual is entitled to a statutory redundancy payment if they've been with you or if they've been employed in service for 2 years or more. And we set out the calculation, and it's done by age. Redundancy pay, as you're all aware at this stage, it's capped at a length of service being 20 years, and for employees made redundant on or after the 6th of April this year, a week's pay is capped at £544, making the maximum statutory redundancy £16,320.
Thanks, Laura. So now that redundancy is covered, we'll move on to what's still really a hot topic at the moment is hybrid working, or as you may also know it, as is referred to as flexible working. So firstly, what exactly is a hybrid work model? So hybrid working is where employees divide their time between working from home and attending the workplace. So for example, their arrangement possibly might involve the employee working from home 2 or 3 days a week and attending the workplace on the remaining days. But these arrangements are maybe different depending on individual employees' circumstances. And when it comes to hybrid working, it is important to note that there is no one size fits all. And there are various types of hybrid working arrangements, and what will work in one organisation may not necessarily work in another. So there's not really a right or wrong approach when it comes to hybrid working. And given where we are at the minute, it may be a case of trial and error before companies really know what's best for them and their employees.
Yeah, I totally agree with that, Jennifer. I'm in a number of kind of HR manager groups, and I could be on the group with 6 different people, and there's 6 different hybrid working models that they're all doing individual forms that suit their company. So there's absolutely no one size fits all. It's whatever works for you and your business. And there are more questions in relation to hybrid working, so we thought we would do a little bit of a Q&A on this one as well. So I'll start off on this one with, is there an automatic right to hybrid working? So ultimately, as an employer, it is your prerogative to decide what is best for your business and your employees. And that's kind of reiterating what we've just said, but it is also worth noting that there is there's a piece of legislation in place that allows all employees who have at least 26 weeks continuous service or employment, they are able to make a statutory request for flexible working, which as an employer you must, you must consider in a reasonable manner as to whether or not you can accept that. So that's just, there's no automatic right to hybrid working, but some employees will have an automatic right to request some form of flexible working. Now, whether or not you approve that, again, is your prerogative as an employer, depending on your business. If you are implementing a hybrid working, should this be in writing? And here I would just say absolutely yes, regardless of what your format is, if it's 2-3 days in the office, if it's however days a month, whatever way you decide, absolutely put it in writing and put it as part of the contract, put it in your policy, in your whatever way, have it in writing so that there is clarity, and ultimately it will provide prevention, any kind of potential disputes, employment law disputes down the line. I would be considering putting it in every employee's contract of employment, because you would have some employees even within your business that are on different arrangements, so it becomes part of your contract. And then for any new hires that you're hiring going forward, you would definitely include, if hybrid working is in your business, include something in relation to hybrid working in the contract too.
Thanks, Laura. And with this model, there are obviously benefits as well as challenges. So to kind of help you navigate through this, we came up with what we think is a good, concise little checklist for you to follow. So just a quick overview of it here. So we have step 1 is look at what works best for your organization. Step 2, communicate your intentions. Step 3, have written agreements in place. Step 4, have a hybrid policy. And then the final step is to always refer back to your company's COVID secure guidelines. So I'm going to take you through these very quickly, just step by step. So for step 1 then, when you're looking at what's best for your organization, as I previously mentioned, hybrid working isn't going to be the best option for everyone. So you do need to think carefully about what your organization has learned throughout the pandemic, and even after restrictions have lifted slightly, just keeping in touch as well with how your employees feel about it. It obviously hasn't been easy for some employees going from being at home, being in this little bubble by themselves, and then now they're coming back into the office. So there is naturally going to be some kind of upset there really around that. So it's just always important to see how your employees feel about implementing such a model. So if hybrid working does appeal to your employees, then you kind of need to think about what will be the best blend, either whether it's more home working or more time in the office, whatever it may be. And then with step 2, communicating your intentions. So once you've worked out what could work best for your business, you need to make sure that you communicate your plans to your employees. It's vitally important that they are always kept informed of what is going on within the business, so that they know what is going to be occurring, so nobody is kind of caught off guard or taken by surprise. So just make sure your communication lines there are always open between you and your employees. Then step 3 is your written agreements. So as Laura mentioned, you should have written agreements in place with your employees to just communicate what is expected of them in order to avoid any confusion and any possible future disputes. And we actually have some hybrid working letter templates available on our website that you can download, and you can amend to whatever the individual employee's written agreement may be. Then step 4 is implementing your hybrid policy. So as previously mentioned, your hybrid policy should detail your split between attending work and working remotely. With government guidelines, safe working constantly changing in response to guidelines being lifted and things like that, your hybrid working policies need to be reviewed a lot more regularly than most other policies. So that's just important to bear in mind there. And then your final step of your checklist is to always refer back to your company's COVID secure guidelines, which again, we mentioned should always be reviewed regularly as well. So next then we're going to move on to menopause in the workplace. And Menopause Awareness Month shone some light on the impact that menopause can have in the workplace. And according to a recent survey, actually fewer than 50% of companies provide any support to female employees for perimenopausal or menopausal staff. And menopause is something that affects us all at work. Even if we don't experience the symptoms ourselves, we will inevitably have a colleague who does. So we just wanted to give a brief overview here of there are 30 recognised symptoms of perimenopause and menopause, a few of which we've detailed here and you can see for yourself. So it's unsurprising that menopause can have an effect on an employee's standard of work. And then the ongoing stigma and kind of the lack of education really around menopause, it can lead to bullying and harassment in the workplace, unfortunately. And many employees report that they actually don't talk about their menopause at work because they feel embarrassed or they're concerned that they won't be supported, or they'll be treated less favorably, or actually viewed as less capable than prior to when they have menopause. So this can really create or exacerbate workplace issues, and evidence does suggest that a number of those experiencing menopause or perimenopause actually leave the workplace altogether. So what is clear is that discrimination and harassment at work can worsen menopausal symptoms of stress and anxiety, and similarly, negative or discriminatory attitudes can make it less likely that individuals from these groups will open up about their status or any difficulties they're experiencing or seek help. So that's why we're kind of bringing up the topic of it today, to kind of get the conversation flowing and to I suppose kind of suggests that having a menopause policy in place would be really vital to your employees and to your workforce. So if it's something that you haven't possibly considered before, we do have a menopause policy in our Bright Contract software that is always available there to have a look at if you'd like to see what it entails and seeing if it would be something that you want to introduce into your business. But this brings us on to then the employer considerations. And given that every person's experience of the menopause is different, there's no exhaustive list of reasonable adjustments that could be made to the workplace environment, and employers will always need to consult with the employee on an individual level and seek occupational health or other medical evidence where appropriate. But some of the adjustments that we have come across that we've included today are just simple little things like increasing ventilation and better access to toilet washing facilities, adjusting working time rules or break times, relaxing uniform policies, adjusting inflexible policies which can penalise those experiencing symptoms, like for example your absence management or performance related targets. So just bearing those adjustments in mind. So how can employers go about improving the workplace for employees who are undergoing menopause, particularly when many employees, as I said previously, they're not willing to disclose details of their condition and the symptoms they're experiencing? Well, firstly, employers should consider implementing a workplace policy, as I mentioned, which will cover these issues such as flexible working, sickness and performance management, and identify sources of support for them as well. But training is also really important, just to educate your workplace, increase awareness and empower managers to feel confident in talking to and supporting their employees who are experiencing these symptoms of menopause. And management should really consider perhaps a budgeting or mentoring scheme or establish points of contact, like perhaps utilising staff who have already been through the menopause to provide encouragement and support to other employees who are going through it. And all of these steps should really encourage employees to feel more comfortable about being open about their symptoms and just to continue to reach their potential by discussing what adjustments they may need. So next we're just going to look to the future, because we're obviously coming to the end of 2021. I'm sure like everyone else, you feel like that time has flown by. And over the last 2 years, obviously the pandemic has meant that many of our previously anticipated employment law changes have been delayed or postponed, with the hope that we are starting to perhaps, I suppose what everyone calls, see the end of the pandemic and its restrictions. 2022 should see legislative developments start to progress further. So we thought we'd look at some of the confirmed and proposed developments that businesses need to be aware of for the coming year. So first up, we have mandatory vaccination. So as I mentioned back at the beginning, from the 11th of November of this year, as a result of the Health and Social Care Act 2008 regulations, all care home workers and anyone entering a care home must be fully vaccinated against COVID-19 unless they fall within one of the exemptions, which can include medical exemptions. And ACAS has published guidance which lists those to whom the law applies to, as well as any exemptions. So that's available there on their website if you would like to check it out. And next up then will be the national living wage and the national minimum wage, which Laura is going to take you through now.
Thanks, Jennifer. Give you a little break from all that talking. And just very, very briefly, I suppose, just in the last budget, obviously, Chancellor of the Exchequer, Rishi Sunak, has announced that, as is normal each year, our living wage and minimum wage will be increased in line with the recommendation from the Low Pay Commission. So as normal, the rates will take effect from the 1st of April 2020. So we've listed the new rates here. Of course, the national living wage is for those aged 23 and over, with the national minimum wage for those of at least school leaving age. The national living wage, the statutory minimum for, as I said, workers over 23, will increase by 6.6% to £9.50 per hour from April. And then we've listed the other increases there as well. So we have a little bit of time before they come in.
Thanks, Laura. So moving on to the coronavirus statutory sick pay rebate scheme, which was obviously introduced to repay employers the current amount of statutory sick pay paid to current or former employees on or after the 13th of March 2020 for periods of sickness related to coronavirus. So obviously under this scheme, employers were able to claim up to 2 weeks of COVID-related statutory sick pay for an employee that was paid. Now, this scheme obviously ended on the 30th of September 2021. But the reason that we have included this section is that employers have up to the deadline of the 31st of December 2021 to reclaim back coronavirus statutory sick pay on this scheme for periods before and up to the end of September 2021. And the employer must keep records for all of the statutory sick pay payments they wish to claim from HMRC, so such as the national insurance number for each employee being claimed for, the start and end dates for the period of sick leave the employee couldn't work, the reason why the employee could not work, and lastly, the details of the qualifying dates in the period the employee could not work. So it's vitally important to have these records and keep them safe should any kind of workplace checks occur. You just want to make sure that you have all of your records for each of these employees.
Yeah, so just moving on then, or almost to the health and safety spot checks, and just going back to our COVID secure guidelines, I suppose, that we talked about at the start. The HSE is continuing to carry out spot checks. So they are continuing to call into workplaces and inspect them to see if you are taking the appropriate measures in place in line with the COVID secure guidelines. I suppose just to say on that, I suppose from everything that I've seen, the spot checks they're definitely not punitive in nature, and they're designed to, and the idea is that they're giving advice and best practice advice, and they're not looking to fine people, but they give employers advice and guidance on how to make changes and how to protect your workforce. But I suppose in terms of just how you still continue to control the risk and keep your risk assessment up to date, everything that we already said at the start of the webinar, just ensuring the ventilation, keeping your workplace clean and the good hygiene, and always consulting with your staff. So, if you're taking these measures in place, you shouldn't have a problem in terms of the spot checks, should you get one.
Thanks, Laura. And this brings us on to carers leave. So in September 2021, the government published its response to the 2020 consultation on carers leave. confirming that it plans to legislate an entitlement to carers leave for employees as a day one right. So the leave will consist of 1 week, up to 5 working days, of unpaid leave per year for those employees with long-term caring responsibilities, which can be taken in either full or half days. And this leave can be taken to provide care or arrange care, either for a person with a long-term care need, such as an illness or injury or issues relating to old age. So employees will be required to give notice that is at least twice the length of the time being requested as leave, plus 1 day. And this new right is likely to be included in a forthcoming employment bill. So we'll be keeping on top of that for you, and you can consult our blog on our Bright Contracts website. So when we hear further more about the employment bill, we'll update you as well through our blog.
Perfect. Thanks, Jennifer. Annual leave, really briefly. I think at this stage we all know that any employee who was on furlough, their annual leave continued to accrue during that period. So I suppose now at this stage, at the end of the year, particularly if your annual leave year is January to December, just be aware of the change that came in right back at the start of this whole pandemic, that being the change to Regulation 13 of the working time regs, which allowed a worker to carry over up to 4 weeks annual leave into the next 2 holiday years, where it was unfeasible or not feasible for them to take the leave as a result of the effects of the last 18 months, I suppose. So just that we're in that phase now at the moment, moving into the new year. So just have that in your mind that you may have employees who will be carrying over quite a bit of annual leave, or up to 4 weeks. But I think there's also an onus there, and employers should be trying to promote that employees do take some annual leave as well. And you can obviously request that employees take leave too.
Thanks, Laura. So finally, we're coming to the end, and I promise you the Q&A is near. But we just have this small section to go, and this section just details how to source software and Bright Contracts can help your HR department navigate a dynamic field that really is constantly changing, which is why HR managers are required to keep up with the times as industries and employment law evolve, either by updating a company policy to reflect legislative developments, or finding ways to just engage employees in order to create a vibrant work culture, and using innovative technologies, I suppose, to help affect positive change in the workplace. Because obviously HR managers, they have a lot on their plate as it is, but there was a lot on their plate over the last 2 years. But this section here is just to go through our product BrightPay Connect. And BrightPay Connect can actually streamline the payroll process, but it also has significant benefits for the HR department too, from data storage and protection to internal communication, and also leave management. So all the things that would take up the HR manager's time and prevent you from working on tasks that really need your attention, this is where BrightPay Connect can help. So Connect is a cloud-based add-on to BrightPay's payroll software, and it combines payroll and the HR functionality to create a product that benefits not only bureaus, employers, but HR and payroll administrators and employees alike. And although BrightPay Connect has many features that have positive impacts on HR management, there are 3 in particular that we thought HR managers would love. And the first is annual leave management. As Laura mentioned, there will be some employees with a huge amount of leave to take, and managing annual leave can be time consuming and complicated, and especially if your business has a large number of employees. So BrightPay Connect includes an annual leave management feature that makes the process more straightforward for both the employee and the HR managers. And it has a self-service app, so employees can request annual leave or unpaid leave via the employee calendar. And as soon as the request has been sent in, it will appear on the HR manager's Connect online dashboard. And from there, the HR manager can check the company calendar to see if anyone else will be on leave on those dates, and either approve or deny the request accordingly. And And furthermore, there is a time-stamped record which is kept of all the requests, approvals, and denials, along with which managers, dealt with them. And this can be very useful if there are multiple managers managing leave requests for their own departments. So it just helps to keep track in relation to that. The next useful feature there then is your document sharing and storage. So Connect actually makes document sharing more efficient and effective, and from their employer dashboard, employers can upload documents to Connect. So these documents are available via the employee dashboards or the employee self-service app, and the employer can actually choose which employees get access to the documents uploaded, and they can choose to make them available to the entire company or to a specific team or department or to just one individual employee. And similarly, they can choose to keep them private if they need to. So for example, if you are using our Bright Contract software, instead of having to email employees their contract of employment or their handbook, you can upload it to the Connect document storage section and make it viewable by specific employees, and they can always refer back to their contract there should they need to. But finally, then Connect makes it easier for HR managers to comply with their data protection obligations under GDPR. And one such obligation relates to giving employees access to any personal data on them that you store. And in the employee app, employees can actually view the information and request to make edits. So for example, if they change their home address, or if they need to change who their next of kin contact is, things like that, they can easily do that through the app, and then they also see what information the employer has of them that they store as well. But to find out more about how BrightPay Connect, you can just simply register your interest in the follow-up email if that is something that you would be interested in looking at.
Perfect. So I'll just take you just briefly on how Bright Contracts can help you be compliant. And we've obviously talked earlier on a lot about having policies in place and how useful and important they can really be. So a lot of what we've mentioned is actually available in the Bright Contracts software. So if you are a Bright Contracts user, you can not only view the content, but you can also print it out and export it. Particularly, you can export it into Connect, which is again a really useful way to share those policies with your staff. For example, we have on the website, we have a template hybrid working letter, and that is downloadable. It's totally editable to suit your business, your needs, as we've talked about, but it's there. It's available for you as a guide, and then you can upload it. In addition, we've also recently updated our handbook to include a hybrid working policy, again, including all the information that we've talked about today. And as with all our handbook policies in Bright Contracts, it's totally editable. No, it's not editable. You can edit it so that you can add in whatever specifics to your business as well. And then also on the contract of employment, and this goes back to what I was saying earlier, in terms of I would put in a hybrid policy in my contracts going forward. So we've edited the core of the Bright Contract software to include a section now where you can include hybrid working. It's really easy to use, and this is live now for you to use. And we also include, we've updated, going back to the start of the webinar, in the COVID secure guidelines, we've included a COVID secure guidelines section in the terms and conditions section of our handbook, and that's there available again for you to use. And you can amend it to suit your company, but it covers everything. We've followed the HSE guidance really closely in writing it, and so it's really a useful starting point if you want to get that in place, if you haven't already. Then to move on to the vaccine policy, we've got a vaccine policy then again, everything that you would expect to be in, and that's there ready to go should you want to take it. And lastly then, as Jennifer talked a lot about the menopause policy earlier on, we have also included a menopause policy in our optional section. So you might not want to, you might not feel it's necessary for your company, but it's there as part of our optional section, and you can use it should you wish. So I think that brings this side of the presentation to a close. We've covered a lot in today's webinar, but we will be sending everyone an email later on, I think, Jennifer, just to include a copy of the slides and a recording. So I think we're going to move to questions and answers, but you might just bear with us for a moment till we bring them up. Thank you very much.
Thanks, Laura. So I just see a question there which says, does an employer commit an offence if a worker who is required to self-isolate due to being a close contact attend work? So here, workers have a duty of care to inform their employer if they're instructed to self-isolate if they've obviously contracted COVID-19. So from the 28th of September 2020, it is an offence in England for an employer to knowingly allow a worker, whether it be an agency worker, to attend the workplace or any place other than where they're isolating for any purpose relating to their employment during the isolation period. But the offence only applies where the employer is aware of the requirement of the worker to self-isolate. If they were aware, then there is a penalty, which can be between £1,000 to £10,000. However, if the worker is due to be working from home or the location where they're required to self-isolate, then the duty to inform the employer of their self-isolation doesn't apply, and the employer can require workers to work remotely at the location where they're self-isolating during the period of self-isolation.
Perfect.
Then I just see, oh, sorry, Laura, go on ahead.
Really quickly, just one on Bright Contracts actually itself. Where can you download the software? So Bright Contracts, it's a sister product to Bright Pay if you're already using Bright Pay, but it is a standalone product. So you download it from a separate website, the brightcontracts.co.uk website. Now the two softwares do speak to each other. So if you want to import your employee data into Bright Contracts from Bright Pay, that's absolutely, that works as quite a seamless import. And then just to let you know on the pricing, so it's a 12-month license period, but it's it's from whenever you start. It's not with the tax year, and it's £199 for a standard license and £299 for a bureau. Sorry,
Thanks,
Jennifer.
Laura. I just see someone asked a very good question there. So can employers use the NHS COVID pass to check an employee's coronavirus status? So the NHS guidance on the pass was really to indicate that it's primarily intended to be used by customers attending events and venues. And under the terms of use of the pass, it does specifically state that it's not intended to be used by employers for the purpose of checking the COVID-19 status of their employees. But use for this purpose isn't actually prohibited. So employers may consider using the pass as part of their approach to providing a COVID-19 secure workplace. But employers using the pass will need to decide whether to make it mandatory or voluntary, and taking into account the organisation's coronavirus risk assessment and the other measures in place to prevent infection. So employees actually, they must be aware of the consequences of not obtaining a pass, and adopting a mandatory approach may raise potential employment law issues. So just to be aware of that as well. But it will kind of present less of a risk than a policy of mandatory vaccination, as employees may have the option of taking a test as an alternative to vaccination. So just to kind of tread carefully around that subject there. Then I just see there, I think it perhaps might have been someone who missed the beginning of our webinar, but just when returning employees to hybrid working, do I need to reissue a new contract? So as Laura mentioned, our advice is absolutely yes. It's best to reissue the contract, or at least an amendment to the contract, because a person's place of work is considered a basic term of the contract of employment. So if the place of work is changing, then that needs to be addressed. So if you're agreeing, for example, 2 days at home and 3 days in the office, then it's best to put that that in writing to avoid any confusions or misinterpretations down the line. So it's also worth having a flexibility line included in the place of work, just to say that it may change as well. And so just to cover kind of all bases there as well. Now, I think some of the other questions require kind of a bit more detailed answers. They're kind of situation specific questions, so we'll actually get back to those individuals directly but via email, and we'll answer your queries there as best as possible. So we'll just leave it there for today. Hopefully you all found this webinar useful and got some bits of information in relation to what's coming up next year as well. But any questions that you may have that you didn't pop in the questions box, please just send us an email. Our email is here on the page, and you can also give us a call as well, and one of our team members will be happy to assist you. But thank you so much again for attending, and as we mentioned previously, this is our last webinar for this year, but we hope to see you all again at our future webinars next year. But thank you so much and take care, everyone.
Thank you. Bye-bye.